In recent times, the need for critical medical resources has intensified in Cameroon, especially the demand for life-saving oxygen. During the COVID-19 pandemic, the management of hypoxemia and hypoxia in Cameroon was challenging due to the limited access to medical oxygen. In order to overcome this challenge, the Clinton Health Access Initiative, together with the Ministry of Public Health, came up with a national strategic plan for the provision of medical oxygen in 2021. In 2023, CHAI supports the Ministry of Public Health in the implementation of this plan by purchasing medical equipment and consumables to be donated to 67 health facilities in 10 regions of Cameroon.
CHAI has been in Cameroon, I think, since 2007. We started working in the HIV space when at that point in time, diagnosis of HIV was like a death sentence. Medications were available but were too high. And through our network of talents and also collaboration with a lot of manufacturers, we were able to successfully bring down the prices of antiretrovirals. And today, basically, antiretrovirals are free in most of the health facilities. So today we are here to actually continue an activity that we started during the peak of COVID-19 pandemic. Because when the pandemic struck, one of the clear things that or clear weakness we observe with our medical system is the lack of medical oxygen in health facilities, and which actually contributed to the high number of deaths that we observed in health facilities. So to address the problem, His Excellency, the Minister of Public Health, Dr. Manaouda Malachie, established a task force which CHAI was leading, and one of the key deliverables for this task force was to develop a 5-year national strategy. And out of so we were able to do the job, develop the national strategy, and we have progressively started implementing the strategy, and it actually involved a number of things like mobilizing funds, training personnel, acquiring the necessary oxygen equipment, and so on. So I think so far we have been able to, with collaboration with the government, we have been able to secure funding from the Global Fund, which will enable the country to construct 5 large oxygen production plants that can generate oxygen that will be sufficient to cover the oxygen needs for the nation. And secondly, through our organization, we have been able to generate resources that has enabled us to acquire materials that can provide oxygen in a sustainable manner in 67 health facilities that are distributed across the National Triangle. And in addition to that, we have also trained the different healthcare personnel to ensure that they have the capacity to use this equipment, administer oxygen, so that patients who need oxygen can actually benefit from the intervention so that their lives can be saved.
Before distribution to the beneficiary hospitals, the medical devices and consumables bought were stored at the Port of Douala and Sename in Yaoundé. The oxygen cylinders, each with a serial number for better follow-up, were transferred to Airgas for filling and calibration tests in collaboration with the Ministry of Mines.
Packaging by serial number will help in case we have a problem in the field. We will be able to track and communicate with the manufacturer. Maybe in case during the manufacturing process something was, the norm was not respected, we'll be able to track. We also know that oxygen is a drug. So we should be able to know that what we send in the field respect the norm, and in case there is something happen, we need to be informed and know what we have sent to the field and how to communicate with the manufacturer.
To ensure the distribution of the equipment to beneficiary health facilities, CHAI worked with the relevant departments of the Ministry of Public Health to coordinate the logistics. devices were given to the different regional delegation of public health at the reception ceremony and then handed to the selected health districts and centers.
We have just succeeded in equipping 67 health facilities. So Cameroon has about 6,000 health facilities. So 67 is just like a very small proportion. But we think that in the near future, the efforts that the government and technical and financial partners are putting in place, I think this problem can gradually be resolved. So already the good thing is that the production capacity, once all the other investments are in place, including the oxygen plant or oxygen tank in Limbe, the production capacity will be covered. So the only challenge will be the distribution capacity. So I think we are working with the Division of Projects and Studies at the Ministry of Public Health to develop some sort of a cylinder distribution system, which is going to be like a hub and spoke model. So we'll produce oxygen in 5 separate regions and then bottle it in cylinders and then distribute it to health facilities in the respective regions. So I think that can to an extent address the problem, but there are other issues that will definitely need to be addressed, particularly issues related to consumables, because these things, most of the things that you need to administer medical oxygen, you use them once for a patient. So we need to set up a system that will ensure continuous supply of the materials, of the accessory materials that are needed to provide oxygen to patients.
As the medical oxygen and consumables reach hospitals, the impact will be greatly felt. Patients will receive vital care as healthcare professionals gain the tools they need to save lives.
Il était difficile lorsque vous avez un problème respiratoire ou un problème, une pathologie qui nécessite de l'oxygène médical. Et nous sommes contents qu'aujourd'hui, aux côtés des autres partenaires, Chai intervient pour pouvoir aider le Cameroun, accompagner le Cameroun à porter ce niveau d'oxygène médical à un moment où nous pensons que notre dispositif médical est en train, et le dispositif sanitaire, je veux dire, est en train de prendre de l'envergure.
The distribution, part of Chai's broader commitment to supporting health systems worldwide, targets medical facilities grappling with shortages and underscores the organization's dedication to enhancing healthcare accessibility in Cameroon. This gesture highlights the importance of global partnerships in addressing critical healthcare challenges.
It's unfortunate that we could not have all these things during the time of COVID. We had a certain consignment where we could not have for each health facility of each service of a health facility. I think we want to thank the donor because oxygen is life. And we want to think that if all our facilities can be provided with all the accessories that they can generate their own oxygen, I think we will rescue a lot of people. Not just adults. Being also somebody linked to maternal and child health, it is very important to have oxygen in that class of people. So these facilities having oxygen with all the accessories to produce and to distribute oxygen, then I want to think is God answering our prayers.
We have been struggling at our level to be able to acquire, I think, a single pulse oximeter, and we're able to have in the time of COVID, we had an oxygen saturation. But with these accessories that have been given to us, with the nature of our enclaved area, it's going to boost the way we are treating people with oxygenotherapy. You know that oxygenotherapy is very vital for a lot of people who have respiratory distress. So if these accessories are coming to us at this time and we are landlocked and we are enclaved, it's really going to boost our treatment first. And also having these logistics where we can be able to train other personnel who we can manage locally, and why not, we can have, with the help of Clinton Health Access, train other people who are around the health district so that we can be able to manage our emergencies rather than sending to Kumba, which is about 50 to 70 kilometers away from us with a very, very bad road.
Hypoxemia has a total of 44 communities, 66 communities, I beg your pardon, a total population of about 45,000 persons. The hospital with the highest plateau technique is the CMI Hypoxemia, which by every standard is a CMI. It's not even a district hospital. So we have cases. This hospital Imagine feeds 45,000, a population of 45,000 persons. So we have many cases of hypoxia that come to the hospital, which needs referral. Like the challenges that I explained earlier, with transportation of referral cases. With this equipment set up in the hospital, it will go a long way to help some of these patients.
C'est un ouf de soulagement que nous recevons ici à l'hôpital de Tissi de Fumbot. Ce donc que vous voyez là, ceci est un ouf de soulagement, non seulement pour le personnel, mais aussi pour nos malades qui sont constamment en difficulté. Nous nous sentons obligés de référer des patients. Je pense qu'avec ceci, sur place, nous prendrons en charge un bon nombre de choses.
Cet appui en équipement d'oxygène médical que nous apporte notre partenaire Tchai aujourd'hui va franchement améliorer l'accès à l'oxygène médical dans la région du Sud pour le bien de nos populations, de nos malades.
During the distribution ceremony in the Centre region, the Minister of Public Health, Dr. Manaouda Malachie, said the equipment will help improve the health of the Cameroonian population and facilitate the availability and accessibility of care for the most vulnerable and even in the most remote regions.
C'est que vous vous battez trop, c'est bien, merci. Merci pour l'accompagnement.
Merci pour tout.